Welcome everyone to today's webinar, Strategies for Orthopedic Revenue Growth in Your ASC, sponsored by Mizuho OSI, a leading manufacturer of orthopedic specialty surgical tables and pressure injury abatement solutions. I am Laura Zuba with Becker's ASC Review. Today, we are joined by Dr. Daniel Chan, an orthopedic surgeon with Cypress Creek Outpatient Surgical Center. Thank you so much for joining us. At this time, I am pleased to turn it over to Dr. Chan to begin the presentation.
Thank you, Laura and Donna, for the invitation. I'm happy to share my limited insights with you all. My name is Daniel Chan. I'm an orthopedic surgeon down here in South Florida in the Fort Lauderdale area. I am the medical director for joint replacement at the Cypress Creek Outpatient Surgical Center, which you can see in my background here. I also serve as the chief of orthopedic surgery and sports medicine and for medical director for orthopedic trauma for the Memorial Healthcare System in Hollywood, Florida. So I wear a number of different hats. But I want to talk to you guys today for the next 30, 45 minutes about revenue growth for the orthopedic service line in the ambulatory surgical setting. And it's an important topic because, as we all know, the finances in the ambulatory surgical setting are very different in the hospital. We don't have as deep of a pockets as the hospital systems do. And so in terms of volume growth and capital acquisition, those decisions are much more, I guess, price sensitive, and especially with post-COVID and labor shortages or supply chain issues, all of those things are amplified and much more noticeable in the ASC environment. So anything that we can do on the ASC side to maximize our revenue will just make it much more successful in the long term. So in the short time that we have, I want to go over a number of different things that I found successful in our ASC operations, and hopefully it'll be beneficial to you all as well. So I'm going to spend some time talking about marketing strategies, and that's something that's near and dear to my heart and something I spend a lot of time on. There are obviously operational efficiencies within the running of the ASC that can help with maximizing revenue. Negotiation with payers is always an issue, especially in light of proposed fee cuts to Medicare, which ultimately can trickle down to the commercial payer level. And also important into address the issue of physician engagement. How do we attract more surgeons? How do we get surgeons to do more cases in our ASC? And then finally, briefly on what other sources of revenue can we tap into other than your traditional commercial payers. So just some basic introduction and kind of setting the stage for this talk. So we know that the migration of previously hospital-based procedures has only accelerated ever since COVID-19. So down here in South Florida, when the hospitals were closed to elective surgery, a lot of surgeons who previously were only hospital-based were essentially forced to at least try out the ASC environment. And at least in my practice, patients that were going to have their surgery in the hospital and now have their surgery in the ASC just realize how much of a better experience it is than being in a hospital. And nowadays, most patients would much rather have their elective orthopedic surgery in the ambulatory surgical center environment. And ASCs are not anything new, especially when it comes to procedures like sports medicine, arthroscopic procedures. Those have been done successfully in the ASC for many years. But now we see that total joints, total hip replacement, total knee replacement has been migrating steadily to the ASC space. And so you see the numbers there, approximately 37% outpatient. This year, it's going to be more than half of all total joints being done as an outpatient in the next 4 to 5 years. And that's not by accident. Medicare is actively incentivizing or pushing that in order to control costs. So while hospital reimbursement remains flat or maybe even slightly up, they are increasing the reimbursement to the ASC on the facility fee side, despite cutting the physician professional fee pay. But that's a separate topic for a different time. So you can see that for 2023, you're going to see between a 4 to 5% increase in the reimbursement to the ASC for total hip and total knee. And as kind of a segue to talking about marketing, we know that of all the specialties in medicine, orthopedic surgery is the one that is probably the most driven by patient consumerism, which means basically patients shop for their doctor. It's no longer the case in most instances where the patient will go on the recommendation of their primary care doctor or family doctor. They're going to do their own research. And so that has significant implications in how we try to reach patients with our marketing strategies in the ASC. So to start off with the marketing part, so like I just said, patients are increasingly savvy and will do their research before deciding on elective orthopedic surgery. And traditionally, people were thinking, well, you know, hip and knee replacement patients, that's the Medicare population. They're not really that savvy. They're not going to go on Google and search, which is definitely wrong for the first part. But even if the patient themselves are not that savvy, they're going to have children who are savvy. And I can't tell you how many times I've had a patient come to my office say, well, you know, I came to you because my son in Chicago did a Google search and found you and told me to come to you. And so that definitely is very powerful. And so to basically the patients are doing their own research. They are shopping around. They're looking at online reviews. They're going by word of mouth. But that's all looking at the surgeon. So it's rare that a patient's going to go online and search, oh, I want the best ASC, because the decision for surgery still rests with the surgeon, him or herself. So when it comes to the ASC administrators trying to market it, it really, you have to step back and think. And so it really depends on how the ASC is set up. So is the ASC owned by a single group? Is it affiliated with a hospital? Is there a single dominant group? So if that's the case, then it makes it a little bit easier, because then you can kind of co-brand and co-market the practice or the surgeons and the ASC as kind of one unit. And that makes it a little bit easier to have something that's more seamless and compelling for patients to see. But if it's a bunch of surgeons from disparate groups that all do surgery at the ASC, that might be a little bit more challenging, because if you're marketing the ASC, then, well, how does the patient who calls the ASC, how is that patient routed? Who gets that referral? So there's a lot of other political considerations when the ASC does the marketing. The next point there is, you know, how much of the ASC revenue is from orthopedic surgery and total joints. That's going to set your marketing budget, so to speak. So if that orthopedic service line is not a dominant service line, but usually it is, that might pose some problems in terms of how much you want to spend. And then you have to look at what are some of the market differentiators for your ASC. So when it comes to total joints and orthopedic surgery, you want to be able to advertise the fact that you use the latest and the greatest. And so for hip replacement, that's going to be having a HANA table to facilitate the anterior approach for minimally invasive hip replacement. Robotics or other advanced things like navigation are becoming more standard, and patients are going to start asking and maybe even demanding to have those things if they're going to go with you for your surgery in your particular ASC, as well as advanced pain management modalities now. So there are different nerve block or nerve pain treatments that are opioid sparing, which appeals to a lot of patients, especially in light of the opioid crisis. And this is something that if your ASC offers, you could also leverage to your benefit. So when it comes to marketing, your online reputation is really everything. Sure, some people still do some print ads and magazines, but everything is really online, and that's no surprise. And everybody uses Google. So your Google results, or your search results, and your search prominence, whatever algorithm is in play, is really going to set the stage for how patients find you. And so in order to boost your standing in Google, you have to solicit positive reviews. That's the only way that you're going to get a higher star rating. That's the only way that your name is going to pop up, or your ASC is going to pop up higher in those search results. And so there's many ways you can do this. You can pay a company, you know, a lot of money to help you solicit that, but there are a lot of cheap things that you can do as well. So one thing that we found very successful is that you can generate a QR code that can link directly to your Google review site. So you can see the 2 QR codes there. That first one in the upper left goes to our ASC Google site, and the patient can QR code that on their phone after they're being checked out for their surgery, hopefully after a good experience, and they can review you on the spot. And the bottom right QR code is for my individual Google profile. So if the patient was happy with their experience with their hip and knee replacement, they can just take a phone picture there, and then they can review us instantly. I also take it a step further. When I have satisfied patients in my office coming in for their post-op visits, I'll send them a customized email and say, hey, Mr. So-and-so, it was great to see you today after your hip replacement. Try to say something that's personal to them. Oh, great to hear about your kids in college. So they know it's not just a generic template email. And you can solicit reviews on Google, health grades, vitals, Facebook, whatever portal patients can generally review you on, and that'll also help boost up your prominence as well. Social media is also the next phase. Again, you can pay somebody to do that content for you, very expensive, but if you're so inclined, you can do a lot of that yourself. So you can share patient stories, you can show videos of patients, obviously with the appropriate consent and HIPAA compliance, show them walking up and down within an hour of surgery, or within the first post-op visit, and all that is very powerful and compelling as well. A lot of surgeons will also post patient education materials online, and that can be very helpful. But it does take time, and you have to kind of feed the beast. So you have to keep doing it for it to kind of keep generating positive results. And then Mizuho OSI also offers a patient marketing kit kind of tied in with anterior hip replacement in the hand table that will also help patients come find you as well. So as an example of kind of how effective this is, I'm not that old. I haven't been doing hip and knee replacement that long, maybe 5 or 6 years at most. I'm actually an orthopedic trauma surgeon by training, but in 5 or 6 years of doing it and optimizing my profiles locally, if you were to search best hip replacement surgeons in Florida, our practice comes up as #1. And our office is located directly in the same building as a surgery center as the ASC. So it kind of is a synergistic effect. Same thing if you were to search best knee replacement surgeon in Florida. By optimizing your Google profile, we also come up as the top ranked surgeon or facility locally. And this is an example of how powerful it is. So this is a Facebook review, but this patient found us on Google. So we're in Fort Lauderdale, which is South Florida. This patient flew in from the Panhandle, from Panama City Beach, because she found us online and she wanted to have an ASC total hip, and she did great. She was walking within an hour, and it says there she flew from Northwest Florida, from the opposite side of the state, which is a 10-hour drive. She flew in just because of our positive reviews. So if you can capture those patient stories and put them out there effectively, they'll definitely reap dividends for you. And so this is kind of speaking to the point of, if your ASC is a separate entity from your practice, you want to find areas how you can kind of build synergies. So even though the ASC is not part of our practice or anything like that, I found a way to try to make it work. So this is my own personal website that I've created on my own, floridahipandknee.com. But very prominently, I also co-brand the ASC. So when a patient comes to my office or comes to my website looking for hip and knee replacement services, I want them to be seeing and thinking about our ASC immediately. And so when you co-brand it together like that, it becomes kind of more automatic and more seamless in that patient's mind that, oh, I'm coming to see Dr. Chan, I'm going to get an ASC surgery. This is the ASC, this is where I want to be. And that kind of facilitates all of that marketing together. I also use Instagram. So I post interesting cases just to kind of generate discussion and buzz. So you can see on the bottom there, there's a picture of an x-ray of a complex pelvic fracture I fixed not too long ago. I have a picture of me talking at my daughter's preschool. But what I wanted to draw attention to is that I have little kind of sections of stories where I kind of promote the ASC. I promote outpatient hip and knee replacement. There you can see me standing in the OR of our ASC with the HANA table. just again, to have that out in the forefront so that patients, when they come across your social media profiles, immediately associate your practice with ASC surgery, with use of advanced techniques and instrumentation like the HANA table. So again, talking about the HANA table, since this is affiliated with Mizuho OSI, it's no surprise that the benefits of anterior approach hip replacement surgery are just, too many to name essentially. And I would say the vast majority of hip replacements done in an ASC setting are done through an anterior approach. And it just facilitates a faster recovery, more precise implant patient placement. It's muscle sparing. We can use live x-ray. The femoral hook really delivers the femur out of the wound to facilitate minimally invasive broaching and safe broaching of the femur for stem placements. So again, the benefits of the HANA table, it's invaluable. The leg spars allow complete mobility of the leg to facilitate the exposure without a big incision. It's totally radiolucent to allow use of intraoperative x-ray. We can fine tune the traction and the rotation. We can do the surgery with less assistance. And then there's a surgery center version of the table that just facilitates storage, where real estate, we know, is always at a premium. So this can be folded away compactly in your surgery center. And it can also be used for other hip procedures like hip arthroscopy. We're starting to see some kind of copycats in the market that will try to adapt a normal table to function like a HANA table. Most surgeons I've talked to just find those incredibly inferior. And so if you're going to make the commitment to do anterior hip replacement in your ASC, I see no other reason than to invest in the HANA table and just get it done right from day one. And to the marketing perspective, again, I've had patients call the office routinely saying, number one, do you do anterior hip replacement because they ask for that? And do you use that special orthopedic table, which is synonymous with the HANA table? And so it's almost a requirement or mandatory to have that in your ASC to draw those patients to the ASC. And again, always trying to facilitate synergy in your marketing. This is my Google profile screenshot, and I also post kind of custom content there, showcasing the HANA table, showcasing our ASC, just to kind of reinforce in the patient's mind that this is how we do things in our ASC. Again, some other pictures showing the benefits of the HANA table, just really facilitating delivering that femur out of the wound to facilitate minimally invasive stem preparation and broaching. And so this is kind of a good illustration of what happens when you don't have a HANA table in your ASC. So those two pictures on the left really show you that you have to drape and prep out both legs. It's a lot more time consuming, uses a lot more drapes and sheets and things like that. You have to attach all these fancy outriggers to do the same thing. Whereas with a HANA table, all you're doing is draping out that small little rectangle. Everything else is away from the sterile field. It just facilitates the setup. It requires less assistance. And that just makes it a lot easier in the surgery center, where if a surgeon is not comfortable in the ASC, you just want to reduce the amount of variability, get them comfortable, reduce the number of steps, simplify the setup, and that'll just make for an easier day in the operating room. Some of the things that I think, other than having the HANA table, are going to be critical for an effective ASC marketing campaign is going to be having some kind of advanced technology. So I personally use computer navigation, which tells us intraoperatively that we're restoring the leg length that people always ask about. Are you going to make my legs even? The computer navigation ensures that. It ensures appropriate implant placement. And it's not just by judging it, by eyeballing it, or by feel. This is very hard, live, reliable data that you can make adjustments to make sure that everything about the hip is perfect before you leave the operating room. And then on the knee side is about robotics. People will now ask, are you going to do my knee with the robot? And so having a robotic assisted technology is fast becoming standard of care, even in the ASC setting. So the big question for the ASC administrators is, how do we pay for it? These are expensive items. And so obviously we're not just going to buy it the second any surgeon says, I want it. So on the Hannah table side, obviously there's financing. You can lease to own, you can rent it. There's a buyback program where they'll take it back if you get it, and for some reason the surgeons just don't show up, they'll take it back in the first year. And some of the implant vendors can also assist with leasing or renting programs, provided you either use their implants or have a volume guarantee. And so there are very creative ways that you can acquire technology like the Hannah table. And the nice thing about it is that it's just a one-time cost. The difference is almost kind of the exact other extreme is with robotics, which is much more challenging because you have significant upfront costs where a robotic system, depending on the vendor, can be anywhere between $450,000 to $1 million. Every robot's going to require yearly maintenance that can be anywhere between $60,000 and $100,000. Every robotic knee replacement case is going to have disposables, including the pins and the trackers. That's going to add up to $1,000 a case. And unfortunately, Medicare or any commercial payer is not going to pay you any more because you're using a robot. So you have to really get creative in how you finance it. Typically, you need to have enough surgeons that can do enough volume to justify it, and you can make it up on volume. But again, vendors can also help you out. It's that if you use our robot, we can defray or offset the purchase cost by you guaranteeing a certain amount of volume. So it is possible. And as these technologies become more mature, I think the price is going to come down. So, and again, volume will drive everything. So that's ultimately going to drive any decision making about acquisition of capital. So on the operational efficiency side, like I said, volume is everything. So the goal is really, again, to do as many cases as possible in a single day, but obviously as safely as possible, right? I mean, we are taking care of patients. We're not running a factory. There is a live person that we are doing an invasive procedure on. And so it's never good to take your eye off of patient care and safety and quality and outcomes. Like I mentioned at the beginning of the talk, labor costs are exorbitant. It's difficult to compete with some of the hospitals when they can offer all these bonuses. So retention of staff and recruitment of staff has been challenging for many ASCs. And so when you have staff, you want to get as much as you can out of them. You don't want them sitting around doing nothing. You want to make sure that for whatever hours they're working in the facility that they are working. And so on busy days, we can do up to 10 or so total hips and knees in a day. We'll start a little bit earlier, like 6:30, so that the staff aren't here till 6 o'clock at night. They can go, we want to get everything done by around 4 o'clock. And so starting earlier is important. And I think the next point is also critical is that you want maximum efficiency, but you're also dealing with surgeon investors who are going to want things done a certain way, or they're going to want certain things. And so you have to juggle those needs. So you may have surgeons that want to come in a couple of days a week and just do a case here, a case there, maybe two cases on Wednesday, 2 cases on Friday. And that's what we call horizontal scheduling. That's very inefficient. So the efficient ASCs, we like going to that surgeon and saying, look, you have 6 cases this week. It's very inefficient for us to do a couple scattered here and there. We'll give you 2 rooms, pick a day, we'll stack them all, do them all in one day. That's far more efficient than kind of spreading them out over the entire week. And then for those busy surgeons, you want to prioritize them because they're the ones bringing volume. And if they're efficient surgeons, then you want to be able to provide them a flip room so that they can do more cases in a day and they can be done earlier in the day, which makes them happier as well. And so once you start getting to that level of efficiency, then it's not just how fast the surgeon can do the surgery, it's how fast you can turn the room over. So it's not just breaking down the table and cleaning the room. What we found early on is that the rate limiting step was going to be our sterile processing department. How quickly can SPD turn over those instrument trays for the next total hip or the next total knee? Then we realized, wow, we really need to buy 4 or 5 trays just so that if one goes down or one can't be processed or other issues, we got to have multiple trays available and backup. And the same goes for power tools, the saws. We have to have 4 or 5 or 6 saws available just in case one goes down or we can't process them quickly enough, because once one item isn't ready, that just kills the productivity, it kills the flow. And so as you get more proficient, you're going to realize that you can never have enough instrument trays or power tools. And then once you start getting efficient, then you need to measure everything, because you can't really make any changes unless you have data. And so, one surgeon, he's probably the most efficient guy I've ever seen. His name is Charles DeCook. He's written about this concept called radical time transparency. And so you want to be able to measure everything. So how long it takes the patient to get wheels into the OR to being either induced for a general or spinal in. And then the time from the spinal in to being prepped for surgery, time from that prep to cutting skin. How long does the surgery itself take? How long does it take to extubate the patient or get him out of the room? How long is the turnover time? When you start measuring each one of those times, then you can see where the bottleneck is and where you can devote your energies to cutting down the latencies. Also, too, you can never underestimate the importance of the recovery room, because if your PACU is filled with patients that are taking 4 or 5 hours to recover before they're leaving the surgery center, that's going to be a bottleneck. So some of the things that we do is that we use a very short-acting spinal. We actually dilute our spinal so that patients are literally walking after a total hip or knee within an hour of surgery, and patients are usually in the recovery room no more than an hour and a half, 2 hours before they're out the door and going home. And so if you can do that, then you can really churn and burn and allow the PACU to accept your next wave of patients coming through. So for us at our facility, we're probably the only surgery center that I'm aware of in South Florida, maybe even beyond, that has actually invested in 2 HANA tables. And that's basically because, I started off being the only surgeon that was doing total joints in our facility. And my practice is very hip heavy. I probably do 70% hips. And so if I have a day in the OR where I have, let's say 7 hips, 8 hips, and just 2 knees, if I only have 1 HANA table, that really is going to slow down my flip room turnovers. So we decided to invest in a second HANA table, and that just allows us to go back and forth, back and forth, back and forth. So on a busy day, we can be starting a total hip on the hour, every hour throughout the day, sometimes even faster than that, including the turnover and closure. And it really takes 2 tables to facilitate that. So if you have a very busy hip surgeon, that's going to be something that you want to do. Or if you have multiple surgeons and you just want to have more than 1 surgeon operating on any given day, then you're going to want more than 1 HANA table to really facilitate that. And so this is just an example of some of the pictures. So this was back in February, where you can see up there on the OR board that we did 10 total joints in a single day, done by 4 p.m., which I thought was very efficient, but that required us to be firing on all cylinders, multiple trays. You can see us there working with the HANA table right there, doing a hip case. You can see us there doing a knee case. And I put this picture on the right because the other important key thing, apart from your surgery center staff, is the implant reps and the sales team, because they're the ones that are making sure that all the inventory is there, that you have enough implants for every single case, that that all the instrument trays are put together well. So I can't overestimate the importance of having a good implant vendor support staff to make this a successful endeavor. Moving on to payer negotiations, this could be a whole hour-long talk in and of itself, and I by no means profess to be an expert in that, but I have been involved in these discussions and strategies. So, what I can say is that there's no magic formula. Everything is local. So what works here in South Florida, which isn't much, unfortunately, is not going to work for you in New York City or California or the Midwest. Everything is local. You have to know your market. So in South Florida, some of the unique things that are here is that we really don't have any big dominant orthopedic groups. Everything is fragmented. Nobody has a significant amount of leverage. Whereas if you go to, let's say, North Carolina or Georgia, you have 50, 100-man orthopedic groups, and that's a very different negotiation with the payers than people that are just in a solo practice or a small group practice. That's a very different dynamic when you are negotiating with payers. You also want to figure out how dominant the hospital systems are, because that can affect how willing the payers are willing to negotiate for your ASC services. In South Florida, we're kind of behind the rest of the country in the maturity of the ASCs. I've only been doing ASC total hips for about hips and knees for about 3 years. And we were really the first to do it in our neck of the woods, whereas in other parts of the country, they've been doing it for well over 10 years. So that also affects how willing or knowledgeable the payers are about ASC total joints. So you can always negotiate on quality. And that's what we did initially, because insurance companies were like, well, what is this? We're not familiar with ASC total joint surgery. I don't know that we want to pay for this. So for some of the payers, we had to basically take a lower reimbursement at first, show them the quality, show them the patient outcome data, show them the lack of complications, no ER readmissions, no infections, no fractures, no dislocations. Go back to the payer later on and say, hey, look at these patients that we did at a discount for you. Now that we've shown you this data, we want a better rate. And then, negotiating on cost, the other flip side is that no matter what you ask for realistically in the ASC from the payer, that you're going to be saving them compared to that patient being done in the hospital. And so, the hospital cost is here, or the hospital reimbursement is up here, that you're down here, or your costs are down here. So it's finding somewhere in the middle where you're making a profit in the ASC and the insurance company is still saving from having the surgery done in the hospital. So it's finding that sweet spot in the pricing that'll work for both parties. And then with the migration away from fee-for-service, using bundles, alternative payment plans, value-based care starting to enter into the orthopedic space, people trying to create these closed, narrow networks, is trying to find a niche for your ASC, going to these entities, whether they be employers or self-insured entities, and saying, hey, we can partner with you, we can offer you quality at a lower cost, and try to negotiate some type of exclusivity. We want to be an ASC center of excellence so that we're saving you money and we can take all of your patients. And that's how I think you can make some really significant inroads. The next thing I want to talk about is physician engagement. And that's always a difficult thing because us surgeons, we're a difficult bunch. We have personality traits that maybe make us difficult to work with at times. I'll be the first to admit that. And so it's always a balance between keeping existing surgeons happy versus recruiting new surgeons. So sometimes you're going to attract a new surgeon and they're going to promise you the world. Oh, I'll bring, 10 cases twice a week, no problem. But then, when it comes to deliver, the outcome is less than promised. And so, basically from an ASC perspective, from an ASC administrator perspective, you want to eliminate any barriers, or I'll call them maybe excuses for the surgeon to not bring more cases to your ASC. So the obvious things are you want to accommodate their block times if it's available. Most ASCs are running under capacity, so usually there's room to give. I think communication is going to be critical. So these next points all deal with communication essentially. So after every surgery, you want to talk to your surgeon and say, hey, what went well? What could we do better? How can we make it more efficient for you? And act on it. The nice thing is that the ASC is much more nimble than the hospital. You don't have to go through 5 committees to make a change. You can make a change immediately and see immediate benefits and results. Communication between the ASC and the physician office is going to be important, because now you have multiple silos, if you will, that may have a hard time communicating. And because it's not in the hospital or in the hospital system, things are a little bit more integrated. That's less so in the ASC environment. So you need to have a good communication between the surgeon office and the ASC office, because sometimes if there's a mix-up in the communication and the surgeons feel, oh my gosh, the ASC dropped the ball, they didn't schedule the patient correctly, or whatever it may be, then the surgeon is going to be less inclined to book more cases, because if it's going to be a hassle, they're going to be less likely to want to make that extra effort to schedule a case in the ASC when they're comfortable with their normal workflow in the hospital. Same thing goes for anesthesia. You need to have very clear-cut clearance protocols. What does anesthesia require to clear the patient for surgery, and to get those clearances done ahead of time? The last thing you want happen is a same day or a last minute cancellation, and that ruins the day. And again, the surgeon's going to feel like, well, why should I bother, trying to schedule these patients when the anesthesia is going to cancel them for the littlest thing. So you want to have that communication. One of the things that is helpful is having a full-time employee in the ASC whose job is just to be the liaison, like a patient navigator that's going to coordinate getting the medical clearance, the labs, the booking from the office and the physician and the PCPs, wrapping it all together with the anesthesiologist just to make it a more seamless process. One of the things that I also wanted to talk about too is, the opportunity to engage physicians by having your existing surgeons try to reach out and do teaching and education for existing surgeons to try to attract them to the ASC. So one of the things that I've done is we use our ASC as a teaching facility. So surgeons that are interested in learning more about anterior hip replacement or learning more about the HANA table, we can do a cadaver lab on a weekend where we'll practice doing anterior approach surgery, practice using the HANA table, practice using computer navigation, robot, whatever. So that just allows surgeons in the community who otherwise wouldn't consider coming to your ASC, they can come see the ASC, see, wow, this is a beautiful facility. I never knew it's going to be so good. It's just so clean and so modern. You got all the equipment here. So you're educating the surgeons, but you're also kind of promoting your ASC as well. And so we've been able to recruit several other additional surgeons to do cases at our ASC by having these teaching labs and having our center be kind of a preceptor site for ASC surgery. So kind of dovetailing that to our final topic of additional revenue. So when we do these teaching labs, not only are we recruiting potential surgeons to come to our ASC, there's also a financial benefit as well, because the implant vendor company typically sponsors these events or these training sessions, and they'll pay the ASC a facility fee. And typically these are on evenings or weekends when your ASC is sitting empty anyway. So this is just extra money for the ASC. So that's something that has been helpful for us as well. The other thing that talking about vendors also is that you have to negotiate aggressively with them. So at our ASC, we've gone to a single source vendor for total joints. That gives us the lowest possible pricing possible. But obviously, if you have different surgeons that want to use their particular implant company, that may be more challenging. So you need to kind of get them all together and see the big picture and decide on one company, usually one or two companies, to get the best pricing. And you can also negotiate across multiple product lines. So it's not just total joints. So the company that we went with, they can do plates and screws for fracture fixation, they can do spine implants, they can do sutures, they can do power tools. And so we can negotiate across multiple product lines to get the best price. And also, we've also done a rebate program. So every dollar that we spend on total joints, trauma, spine, sutures, general surgery, whatever, mesh for hernias, in that same company, we get a percentage of that money as cash back. So it's an incentive for us to use more of their stuff or to be exclusive with them, but that also nets us savings in the back end that we can use for other things. It's basically cash back, so we can use it for whatever we want. And that's also been very successful for us. The last thing I want to talk about is medical tourism and self-pay. And that's going to be important for a lot of ASCs because, as we just mentioned earlier on, Medicare is not paying the physicians anymore. The commercial insurances probably will follow suit. And as ASC surgery becomes less, I guess, exotic and more of a commodity, you know that there's going to be downward pressure on reimbursement. So where can we find a better payers? Obviously, workers' comp is a big one. And so our surgery center does a lot of workers' comp. But appealing to that cash pay patient who either international or coming from out of town, I think is worth the effort. In order to make that successful, you need to have very straightforward, kind of flat, all-inclusive pricing, be very transparent about that. You need to provide that patient with a concierge-like experience. And you can also market this same product or this same service to other employers or other medical cost-sharing companies or other big employers, for example, who are sending, you read stories about big employers sending patients to Mexico to have total joint surgery at a Mexican hospital. So our proposition is just like, well, we could do the same better, keeping it stateside, and probably for cheaper too, given that it's done in an ASC and not in the hospital. So those are some of the things that we're working on. These are some of the pictures of us, of me doing a teaching lab in our ASC. You can see we're using the HANA table there on a cadaver with the latest instrumentation. I'm giving a lecture before the ASC demonstration about the implants, about the approach, and these are some surgeons in the community that we're trying to recruit. And finally, to talk about more about the medical tourism aspect, obviously this is not possible everywhere, but our ASC is kind of a unique location in that my office is directly above the ASC. So you can see the ASC is right here and my office is directly above it right there. So it really creates a nice one-stop shop. So our office is 9,000 square feet. We have physician offices. We have physical therapy in one location, right above the surgery center. And we're also located directly adjacent to Fort Lauderdale Executive Airport, which is the second busiest private airport in the country. So there we are. That's our location. There's the airport right next to it. So we have this situation where theoretically, if you had a self-pay patient coming in from South America or the Bahamas, they could fly in early in the morning. They could see me in consultation in our office in the morning. They can go to the urgent care attached to our facility, in our facility, get some basic labs. If they check out, they could have their surgery right away later in the morning. They could come back upstairs and have their physical therapy in the afternoon and then fly home all in the same day. And so that becomes a very compelling proposition for those patients that want to take advantage of that. And so as we mature, we're going to try to take advantage of more of those patient opportunities. These are just some photographs of our surgical center waiting area, the reception area, the OR, and the PACU. Again, we just want to create this concierge, very modern, very advanced, very patient-centric environments. These are some of the ORs in our ASC, showing the HANA table, showing how big the ORs are. The two ORs in our ASC that are for total joints, where the HANA table sits, they're bigger than our cardiac and trauma ORs in the main hospitals. So that just shows the investment that is often necessary to kind of create that, that top tier experience for both the surgeon and the patient. Some of the photos, this is our physical therapy facility directly above the ASC, has all the weights, all the latest equipment, including a Alter G or negative gravity treadmill, and just creating an environment of kind of active patients, sports medicine, just kind of a really high-end orthopedic concierge-like environment for our patients. And so with that, I will conclude. If anybody has any questions, you can always email me there. You can find our website at floridahipandknee.com, and all of my social media profiles you can see there. My handle is Daniel Chan Ortho. And thank you for joining me, and hope you guys are successful in your own ASC endeavors.
Thank you so much, Dr. Chan, for your insights today, and to Mizuho OSI for sponsoring today's webinar. And thank you to our attendees for tuning in to listen. Enjoy the rest of your day, and we look forward to having you join us for future webinars.